So it's widely reported that Tom Cruise and Katie Holmes do it, sleep in separate bedrooms because he snores too loudly.
Really?
Yeah. A lot of people may identify with that though too, because sadly it's not unusual. They say 1 out of every 5 American couples sleep apart because of snoring issues.
Unbelievable. 1 in 5, 20%. There are lots of home remedies, but do any of them work? That's what we want to know. Today we're going to ask the doctor. Dr. Madan Kandula is with Advanced Ear, Nose, and Throat Specialist, also known as Advent. This is a great topic. Good morning to you.
Good
Thanks
morning.
for being here.
Thank you.
So, were you surprised by any of the statistics? Because Allison and I were talking a little during the commercial break. 45% of all Americans snore, so almost half of us.
Right.
Okay.
At some time. Yep.
At some time. 25% of all Americans are chronic snorers,
right.
So we do it all the time.
And then some snore like a freight train.
Exactly.
Some have just a little wheeze. But I mean, it can be really bothersome.
Oh yeah. I mean, it's
Annoying.
serious. It's very annoying. I mean, it's something I deal with every day, so I kind of get numb to the numbers because I see lots of folks coming in just for this problem. But yeah, when you take a step back and you think about it, it's amazing. I mean, there's, we're all married here and and people who are in significant relationships, but to have, 1 out of 5 have a wedge being driven between them is significant.
Yeah, well, they're sleeping in separate bedrooms. That's a lot.
And the thing is, that can be prevented.
It can, exactly. I mean, that's the thing. There's nothing good about snoring. I mean, golf, maybe there's some good things with that, and there are things that are enjoyable. The snore, there's nothing enjoyable about snoring, and it's certainly, they're annoyed by annoying somebody else, and the person that's annoyed is obviously annoyed at that person.
Well, let's start maybe with what is snoring.
Yep. Snoring is a really annoying sound that comes from the back of your throat, and usually what's happening is there's some narrowing towards the back of the throat, and the tissue back there is flopping around.
It's flapping. It's
exactly.
that. Is it the uvula?
That little uvula, which is a little punching bag in the back of the throat, the area up above there, and that guy that's the most common spot for snoring to happen.
If people have had their tonsils removed, are they a lot less likely to snore?
Less likely. Not.
Okay.
It depends on the anatomy back there, but
that probably wouldn't be a cure. And we're going to talk about some of the remedies in just a second. But it can be physically harmful too, not just harmful to a relationship and annoying, but it can hurt you health-wise.
Sure.
Right?
Yeah. I mean, there's just pure primary snoring, which is without stopping breathing at night. That's disruptive to sleep. So if somebody is snoring, they're not sleeping as soundly as they need to. And then sleep apnea, which is becoming more and more known nowadays. Everybody who has sleep apnea snores. So you never really know. If somebody snores, you never know whether it's just annoying or whether there's something really life-threatening going on.
There's a serious health reason behind it. So there are like all these different remedies for snoring. What are some of the most common ones you hear in your office?
Everything and anything. I mean, this has been around. This is not a new problem. We've got a lot of new treatments nowadays, but this has been, sort of the snake oil salesman from back in the day. Lots of their remedies were for going after sleep apnea. I mean, after snoring and anything and everything. I mean, I think nowadays it kind of comes into 2 categories. One would be things that can help somebody breathe through their nose, and lots of people who snore have trouble breathing through their nose.
Well, they wear those little breathing strips
and that's fine. If it works, usually that's indicative that there's something else going on that probably ought to be corrected definitively.
Okay.
So that's one side of things, and that stuff, if it's doing the trick, is pretty good. Then there's the whole other camp of things, pillows and sprays and other devices that try to kind of disrupt your sleep, get you off of your game, and see if you can, if you're not sleeping, you're not going to be snoring, basically.
Well, I've heard people tape tennis balls to their backs so that they will stay on their side and not roll over to their back, because a lot of people snore on their backs.
Yep,
Interesting.
absolutely.
What really works?
What works, there's a couple things that work. The fixing the nose, like we just talked about before, can work very well. And then the pillar procedure, which we've talked about a little bit in the past, works very, very well.
What is the pillar procedure?
The pillar procedure is it's a set of implants we put in the back of the throat, right above that little uvula. And what it does is it stiffens the tissue. So we put it in the office, very simple to do, and it works amazingly well.
Okay. And does that last forever?
Yep. It's forever.
And what are the results like once you get the pillar
They tend to be
procedure?
outstanding for the right candidate, and that's the key. Not all snorers are candidates for that. For instance, somebody who's got severe sleep apnea is not going to be a good candidate for the pillar procedure. But if you've got the right anatomy and sort of the right story as far as what's been going on for you, it can be a dramatic improvement.
What is the recovery time like for someone who has the pillar procedure?
Minimal. I mean, really, they come in, get it done. It's like going to the dentist where we numb up the back of the throat, and they're back to doing what they do when they walk out.
So really probably the key is in first determining whether you have sleep apnea or you're just maybe a chronic snorer. And if you're a chronic snorer but you do not have sleep apnea, you could potentially be the right candidate for that. Is there any easy way for people to tell if they have sleep apnea, something serious versus something?
There's nothing easy. I mean, a lot of times for folks like me who deal with it all the time, we can kind of get some clues, but sometimes I'm wrong as far as if I think somebody doesn't have it and they do, and vice versa. But the thing to do is get checked out by somebody who knows, knows what the lay of the land is.
Okay. When should people consider seeing a doctor if they do snore? Their partner tells them, you snore. You need to stop.
Well, I think those 20% that are sleeping apart, I don't see why you wouldn't. If it's disrupting your life or those around you, absolutely. If there's any concern that you're stopping breathing, then absolutely it ought to be checked out.
Is the pillar procedure ever effective for people who have even just really mild sleep apnea?
Yeah, it is. It can be. I mean, it depends on the anatomy back there, but yeah, that's one of the indications for it.
And there's this website or this kind of survey that you can take online too, right? To kind of at least get an assessment, figure out what your score is as kind of a screening method.
Exactly, and that helps. I mean, because it sort of pins it down. It asks very sort of straightforward questions as far as how loud it is. Does your bed partner sleep in a different room because of what you're doing? That sort of thing.
Great. And you can find that test. We'll have a link on our website, themorningblend.com, if you want to take the What's Your Snore Score. You can figure that out. But in the meantime, here's the information for Advent. We're talking to Dr. Kandula today from Advent. They're located on North Mayfair Road. Their phone number, 414-771-6780, or go to advent.md for more information. Dr. Kandula, thanks for being with us.
Thank you.
Good stuff today. Thanks, doctor. Still ahead on